So if you have had depression in a previous pregnancy or prior to becoming pregnant, you're at risk for postpartum depression. If you have experienced adversity as a child or trauma, if you've had an extremely traumatic birth experience for your current pregnancy, and if you've had little or no support in the home once you bring the baby home from your family or spouse or partner. If you are young, your age can play a role. Not always, but it can impact. So if you are under the age of 20, if you're having a hard time breastfeeding, if you have a baby that was born prematurely, if your baby has special health care needs. So there's a range of risk factors that you can experience, that may play a role in postpartum depression.
What about race and your background or even where you're from, things of that nature? Can that play a role?
Absolutely. So we know that postpartum depression, the prevalence of postpartum depression is higher in our communities of color, so our women of color, our Hispanic communities, our Black communities, and that definitely is a risk factor because some of it is tied to whether you actually seek care for what you're feeling, cultural experiences, or it can be related to where you live, your home environment, and your financial status. All of those things play a role and can be a risk factor.